Environment Canada is again warning that wildfire smoke is causing very poor air quality for much of Ontario, and that brings health risks for millions of people. Dr. Vhaibav Gupta is a chief medical advisor of the Lung Health Foundation, and he joins us now from London, Ontario this morning. Dr. Gupta, thank you so much for spending time with us.
Good morning, Chris. My pleasure to be here.
I can see you're right next to a window. What are you seeing out there?
You know, like many of us in Ontario, we're seeing very hazy skies, you know, things that we haven't really seen recently in this area. And was quite striking yesterday to wake up to a yellow world, which has really caught many of our attention.
For sure. I mean, striking, shocking, and really hard to just be in that kind of condition. Dr. Gupta, I want to just break this down in simple terms because many people watching this morning will be heading out the door, commuting, whether they're walking, whether they're even in the car. And I want to know, is there any amount of time that is safe to be in this condition?
Yeah, well, you know, when we're seeing smoke like this, then the particulate count in the air is so high. We really want to minimize our time outside. You know, and it depends on how we are as individuals and our lung health as individuals. But I would suggest that no great amount outdoors, especially in this setting, is safe. In fact, wildfires, even when we can't see the smoke like this, but we know that wildfires are nearby, it's not safe. So when it's a situation like this, we really have to be mindful about our time outdoors and our health outdoors.
In these conditions, do you suggest that everybody wear a mask?
I think anybody that's going to have prolonged exposure outside, you know, some of us have to work outdoors or have to be outdoors. So if you're going to have any prolonged exposure outside, I do recommend that you wear a mask, whether it's a simple face mask or if you have an N95 mask. You know, many of us got familiar with these during COVID, and that's just going to help filter out these particles and is going to make it easier for you to breathe.
Dr. Gupta, let's talk a little bit about minimizing impacts if you do have to go outside. I also want to start with vulnerable groups who have no other alternative but to be outside. How do you minimize some of the impacts?
Yeah, that's a great question. So there's a few things that we can do to make it safer. The first thing is that if you're traveling in your car, to keep the windows closed, to ensure that you're circulating the air within the car, and to make sure that your car air filters are up to date. That's going to help. And for those of us that are at home, similar advice, making sure that your air filters are up to date. You can even buy a portable air cleaner, particularly if you're in one of those vulnerable groups. And, you know, we're talking about patients with asthma, COPD, but also patients who have other health conditions, you know, patients who have heart conditions, because really the lungs are connected to the rest of your body. And having difficulty breathing and having difficulty getting oxygen in is going to affect your health in general.
And Dr. Gupta, on the other end of the spectrum, for people who are generally healthy, they might think, oh, I think it's fine for me to spend some time outside. What would you say to those people who are sort of pushing through these conditions?
Yeah, well, you know, like many aspects of our health, sometimes we can get through things without paying attention to them. But it's these kind of things that over time can really impact our health or can reveal themselves later. We know from data in Ontario that when we have wildfires like this, presentations to the emergency department increase, admissions to hospital increase, and sometimes this kind of situation unmasks a lung condition that people may not have been aware that they had.
That's such an interesting point. And I know that for those who are spending some time outside and that mild headache starts to creep in or a scratchy throat, what should people be doing about that? And at what point should they be concerned?
Yeah, so you're absolutely right. The symptoms can be subtle. As you mentioned, it can be a slight headache or slight dizziness, or even just some chest tightness or some chest discomfort, you may not explicitly feel chest pain, but those are some early signs. So what we need to do, we need to make sure we're staying hydrated. If you are heading out, to keep a water bottle with you. When you feel it in your throat, to make sure that you're taking sips of water and staying hydrated. Considering what activities you have to go outside for those who are employed with outdoor work, speaking with your employer to make sure that they're taking precautions to minimize your exposure, deferring work that could be done later, because we do expect this to clear, and it would be safer to reschedule work that can be avoided right now.
Dr. Gupta, I want to ask you about one more vulnerable group. So that would be the young children, because I know because it's summertime, many kids are out there in camps. Sometimes you can't keep a kid from running around outdoors, and maybe they might not realize that it's having an effect on them until it's too late. What's the advice for parents?
Yeah. So the advice for parents, teachers, camp counselors is first to get educated themselves and to use this as a chance to educate the kids through activities, etc. We really do have to protect the kids and plan activities indoors. And when we are staying indoors, making sure that the air inside is clean. So we're talking about ensuring that we're not adding to the pollution. So any indoor smoking or vaping really needs to be minimized, especially around children, but around all of us. When the air quality is so poor outside, then we need to focus more on the air quality inside. That also extends to candles. I mean, I know it's the summer and we're not lighting candles, but it's remarkable how much candles can add to the indoor air pollution. And for those who are indoors, to keep the windows and doors closed, to ensure that you have your circulating fan running, making sure that your filters in your home are up to date. And people can buy indoor air filters as well. And I would recommend that if you have any lung condition or other serious health condition, or you have a very young or very elderly people around who may need that and may make a difference for them to be able to breathe through this season.
All of that useful takeaways. Thank you so much, Dr. Gupta.
My pleasure, Chris. Thank you.
That was Dr. Vhaibav Gupta, who is a chief medical advisor of the Lung Health Foundation.